Hey everyone, welcome back for another deep dive.
Always exciting to be back.
It's funny, we were just talking before we started recording about how, everyone's dealt with a UTI at some point, right?
Right.
Or knows someone who has.
No, absolutely. Yeah, they're incredibly common.
But it's not something people, love to talk about.
No, not exactly dinner table conversation.
Exactly. But that's why we're diving in today. Because, let's be honest, UTIs are kind of fascinating when you get down to it.
100%. And based on the articles and questions you all sent in, it's clear you're already pretty savvy about the basics, so we're going to go deeper.
Love that. So, we've got a really cool source to guide us today. It's actually a podcast episode itself, a conversation between a urologist, Dr. Sammy, and a med student named Habiba.
Great setup because we get both sides of the coin, the expert knowledge from Dr. Sammy, but also Habiba asking the questions a learner would.
Yeah, exactly. It's like we're eavesdropping on their study session. So to kick things off, most folks are familiar with the classic UTI symptoms, that burning when you pee.
Oh, yeah, the dysuria.
Right. Quasuria, I've used the fancy term. Then there's feeling like you constantly have to go.
Frequency and urgency, yep.
Yes. But what I found really interesting in this podcast is how Dr. Sammy emphasizes those are the hallmarks, but definitely not the whole story.
Totally. And that's crucial, especially for anyone listening who suspects they might have a UTI. It's not always so clear cut.
So hit us with some of those less common but still important signs he talks about.
Well, one that you specifically mentioned wanting to explore more is hematuria, so blood in the urine. And Dr. Sammy points out this can be a sign of a parasitic infection in the urinary tract, which, sounds a little scary.
It's definitely not what you want to hear.
Right, but it's important to know it's a possibility. And then there's flank pain, which could indicate the infection has spread to the kidneys, a condition called pyelonephritis.
Okay, so pyelonephritis, that's something I saw mentioned a bunch in the questions we got. Can you break that down a little?
Sure. So pyelonephritis is basically a kidney infection. And Dr. Sammy really stresses to Habiba that this is serious. If it's not treated promptly, it can have some pretty major consequences.
And that makes sense, right? Your kidneys are essential organs. You don't want to mess around with those. So, okay, we know the usual culprit behind most UTIs is E. coli bacteria, which kind of makes sense if you think about it.
Yeah, because it usually hangs out in the gut, right? Which is, anatomically speaking, pretty close to the urinary tract.
Exactly. But it's not as simple as, oh, I have E. coli, so I definitely have a UTI, right?
And Dr. Sammy does a really good job explaining this to Habiba. He talks about how E. coli actually has these things called fimbria, which are these tiny little grappling hooks that allow it to attach to the lining of the urinary tract.
Oh, wow. That's wild. I never thought about it like that.
Yeah.
So it's not just about the bacteria being present. It's about its ability to, hang on and cause trouble.
Exactly, which is why things like sexual activity, which can introduce bacteria, or even things like menopause, where hormonal changes can make the urinary tract more vulnerable, can increase the risk of UTIs.
Okay, that's super interesting because I was just reading an article about how...
And this is where it gets really fascinating because Dr. Sammy brings up the scenario to Habiba. Imagine a patient comes in, all the classic UTI symptoms, textbook case, but their urine culture comes back negative. What then?
Ooh, that's like a medical mystery.
It is. And this is where a doctor's expertise and critical thinking really comes into play.
So what are some of the possibilities Dr. Sammy throws out?
Well, he explains that it could be a different type of bacteria causing the infection, one that maybe doesn't show up on the standard urine culture. Or the sample itself could have been contaminated, which can throw off the results.
Oh, yeah, that makes sense.
Or, and this is where it gets even more intriguing, there could be something else entirely going on that's mimicking those UTI symptoms. Something completely unrelated to the urinary tract.
Wow, that is wild. So what's the takeaway here?
I think it highlights a really important point for everyone listening. Tests aren't foolproof, right? And diagnosis isn't always a straightforward process. It takes careful consideration of the patient's symptoms, their history, and, sometimes a little bit of detective work.
Absolutely. That's such a good point. So to kind of sum things up for everyone, UTIs, they're not as simple as we might think. We've got E. coli with its grappling hooks, the surprising link to hormonal changes, and the fact that diagnosis isn't always black and white.
Yep. And I think another key takeaway is that even with all the advancements in medicine, UTIs remain super common, and sometimes they can be really tricky to deal with.
Right. And it makes you wonder, If they're so common, are we missing something in terms of prevention? What could the future of UTI treatment look like? Definitely something to think about.
Lots to ponder.
All right, everyone, keep exploring, keep those questions coming, and we'll catch you on the next deep dive.
See you next time.